In this video lecture, we'll be discussing the psychodynamic approach to anxiety and phobias, with a particular emphasis on the traditional Freudian explanations for anxiety. So we are going to discuss the psychodynamic approach by talking about one of Freud's best-known case studies, in which he discusses the analysis of a phobia in a 5-year-old boy, often referred to as the Little Hans case study. So Little Hans was a 5-year-old boy. He was not a patient of Freud's. Freud only met him in person once. Little Hans was being analyzed by his father, and much of what we know about the case of Little Hans comes from letters that were exchanged between Little Hans's father and Freud. And one of the primary topics of this case study was Little Hans's phobia of horses. He was very afraid of horses, to the point that often he was reluctant to leave his house because there was a busy carriage building across the street, so there were often horses present. And one thing that we know about Little Hans is that he had experienced outside in the street, outside of his home, witnessing a pretty distressing accident with one of these carriages, where a horse actually died in the street and fell down. It made many loud sounds. The horse had been pulling a cart that had many boxes in it. So a behaviorist perspective might have considered that an opportunity for classical conditioning and might have viewed Little Hans's phobia as evidence that he had a conditioned emotional response to the stimuli that were involved in that experience, for example, horses. However, Freud has a very different interpretation of why Little Hans developed this phobia of horses. So one piece of information that is important for Freud's conceptualization of the case is that around the age of 3, Little Hans started expressing a very high level of interest in whittlers, which was what he was using to refer to penises. He was very interested in touching his own whittler. He was interested in talking about whittlers. He was interested in asking if other people had whittlers. For example, he asked her mother if she had a whittler. And Little Hans was discouraged from doing this, and at one point his mother actually threatened that if he did not stop talking about his whittler or touching his whittler, that she would cut it off. So this started occurring around the age of 3, and from a Freudian perspective, it's important to note that at the time that we are considering Little Hans's phobia, he is at the age of 5. This is during the phallic stage of psychosexual development. And remember that one of the important things that is happening during this psychosexual stage is the Oedipal complex. So according to Freud's developmental theory, during this stage in development, what happens is that for boys, they become sexually attracted to their mothers. However, this produces anxiety because by being sexually attracted to their mother, they are being put in sexual competition with their fathers. And one thing that these young boys will be aware of is that they have small penises and their fathers have large penises. And they are anxious that their small penis will not be able to compete with the father's large penis, and that if the father becomes aware of this competition, that the father will cut off the boy's penis. So this is what Freud calls castration anxiety. So during this phallic stage of development, because the young boy is sexually attracted to his mother, but simultaneously afraid of his father, and that his father with his large penis will cut off his smaller penis, there is a high level of unconscious anxiety during this Oedipal complex. In a normal Oedipal complex, in traditional psychodynamic approaches, this is resolved when instead of sexually desiring his mother, the boy develops an identification with his father. So instead of trying to compete with his father's large penis, the boy decides that he wants to be like his father and develop his own large penis, and develops his appropriate gender identification. This is involved in developing a superego. So this is the process by which that Oedipal complex is resolved in healthy psychosexual development from a traditional Freudian approach. When we think about this Oedipal complex and the development occurring during the phallic stage, this was a really important part of Freud's conceptualization of Little Hans's phobia. So from Freud's perspective, little Hans was not actually afraid of horses. Instead, the horses were symbolic of what little Hans was actually afraid of. And little Hans was actually afraid of his father because of this Oedipal complex and his castration anxiety. And Freud saw several clues in how little Hans talked about horses and talked about his phobia that led him to believe that this theory of Hans's phobia was correct. So one thing that was particularly important to Freud's theory is the fact that horses have very large penises. So because little Hans's castration anxiety was characterized by fear that his father with his large penis would cut off little Hans's small penis, the horse was an appropriate symbol for little Hans's father because of the horse's large penis. There were also other elements of the phobia that Freud saw as characteristic of this symbolic role that the horses were playing. So one thing that was characteristic of little Hans's phobia is that he was particularly anxious about horses that had blinkers around their eyes. So this is a piece of hardware that's often used with horses that are drawing carriages, where there are things put up along with the bridle that stop the horse from being able to see to the sides. This prevents the horse from being frightened by things passing in their peripheral vision. And little Hans's father wore glasses. So Freud saw the fact that little Hans was more afraid of horses that had these things around their eyes, as suggesting that horses that more closely strongly resembled his father were creating higher anxiety. And similarly, little Hans was particularly afraid of horses that also had things around their mouths, which was consistent with little Hans's father's mustache. There was another element of this phobia where little Hans also really didn't like it when horses were drawing carriages that had many boxes on them. Freud related this to little Hans's anxiety around the time that his younger sister had been born, shortly before he developed his phobia. So from the Freudian perspective, the boxes that were being carried by these horse-drawn carriages that were leading Hans to have this particularly intense anxiety were symbolizing his anxiety about his sister's birth and his mother's pregnancy, and his distress around the birth of his sister and his mother's role in being pregnant and bringing his sister into the world. So from Freud's perspective, it appears that little Hans has a phobia of horses and particularly is afraid of horses that are drawing carriages, that are carrying boxes or packages. But this is not truly representing a phobia of horses or carriages. What this is really representing is unconscious anxiety. And this unconscious anxiety is a castration complex. It is a fear of little Hans's father, particularly a fear of this psychosexual competition between little Hans and his father that's characterizing the phallic stage of his development, and also a related anxiety about his little sister and about learning where babies come from, and about his mother and his relationship with his mother. So this is a somewhat extreme example that provides a clear illustration of how Freud thought about neuroses, or the neurotic disorders. So remember that when we talked about psychotic disorders, we compared them to Freud's conceptualization of neuroses, where in neurosis, the ego suppresses part of the id out of allegiance to reality. So in our neurotic disorders, we often have defense mechanisms that in a healthy psyche are helping manage the anxiety or arousal that is in our unconscious and helping keep it out of conscious awareness so that we can engage in the world. In neurosis, sometimes these defense mechanisms might become overly active. They might fail to keep unconscious information from reaching our conscious awareness, or they might distort things from our conscious awareness in ways that become maladaptive. So when we think specifically about anxiety and phobias, one of the most important defense mechanisms that we are going to consider is the role of displacement. So from a traditional Freudian perspective, our phobias and many of our anxiety disorders result from displaced anxiety. So when an individual is experiencing anxiety or arousal in their unconscious, that is unacceptable. So when the knowledge of this anxiety and the true nature of the anxiety cannot be brought into conscious awareness because it would be threatening or unacceptable, the ego manages that anxiety by using the defense mechanism of displacement. And that anxiety is displaced from the inappropriate object that the person cannot become aware of onto an object that is more appropriate. So in the case of little Hans, his castration anxiety about his father is displaced onto the horses. Similarly, his displaced anxiety and distress around his younger sister and his anxiety around learning where babies come from is displaced onto a more socially appropriate symbol of boxes and carriages. So the traditional Freudian elements of this explanation, particularly the emphasis on psychosexual development, castration anxiety, and the Oedipal complex, are not characteristic of modern psychodynamic explanations for anxiety disorders and phobias. However, the idea of displacement continues to play a key role. So for example, in the case study that you read about Mercedes, one thing that the therapist paid a lot of attention to was the fact that Mercedes appeared to have a lot of anger towards her mother that she often appeared unable or unwilling to acknowledge or to talk about. So a more modern psychodynamic approach might explain Mercedes' panic experiences as displaced anxiety. So in her unconscious, she's angry at her mother, but her superego says it's not okay to be angry with your mother. Your mother loves you and you are supposed to respect her. So the ego activates a defense mechanism, and that anger is repressed out of awareness. It stays in the unconsciousness, but that arousal that is created by that anger ends up being displaced. So it is displaced onto other objects and circumstances and reaches her conscious awareness not as anger, but it reaches her conscious awareness as anxiety or panic. So from a more modern psychodynamic perspective, often when we are seeing anxiety, we are seeing the experience of anxiety or arousal that represents true anxiety or arousal that is present in the unconscious, but that has often been displaced onto another object or situation that is more socially appropriate or considered more appropriate by the individual in comparison to the true nature of the anxiety that accurately characterizes their unconscious feelings.